So ladies and gentlemen, welcome once again to Health, Hygiene and Wellness. This is a program that comes to you every Monday at 7:30 p.m. where we discuss matters about our health, our hygiene as well as our wellness. In the program today, I'm hosting Dr. Silas Wambulwa and we're going to discuss about hypertension. I hope you stay tuned for more insightful and educative discussion. My name is Barasa Saenyi. Welcome to this program. Karibu sana daktari.
Thank you.
How are you this morning?
I'm fine. Thank God.
Yeah. So leo tuzungumzie masuala ya hypertension.
Yes. Yeah.
Welcome. Sasa what are the brief descriptions can you give about hypertension?
Thank you so much. And I want to welcome also viewers to this important session.
Yes.
Because nowadays, if you visit any family, if you attend any burial, I'm sorry to start on a sad note, everybody will tell you the person you are burying today, especially the adults, most likely they could have died of blood pressure or maybe hypertension,
Yes.
a stroke, a heart attack.
Yes.
Yeah, the patient just collapsed and died at home.
Heart attack is the same as cardiovascular.
Yeah, cardiovascular arrest. So it is becoming very common, not like the previous days where we used to have malaria and other infectious diseases
Yes.
causing death. But nowadays, the government has controlled infectious diseases. So whatever is affecting our people, especially the adults, is now hypertension,
Yes.
the cardiovascular complications, which we'll mention today, and probably cancer. But if you look at the causes of death in Kenya, you look at the statistics nowadays, cardiovascular is the leading cause of death. More than even COVID, more than TB, more than malaria.
Yes.
Cardiovascular complications, including hypertension, they are the leading cause of death in fact in the whole world. Yeah. So hypertension per se is part of the cardiovascular system, and it's a disease of the cardiovascular system. So hypertension, the description of hypertension is just persistently increased blood pressure more than the normals for a very, very long time. Okay, somebody can tell you that I don't have hypertension because I had stress, then my blood pressure went up. As doctors, we know how to diagnose hypertension. We don't just test you once and tell you have hypertension. No, we'll tell you to go, come back. We retest again,
Yes.
again and again. That's when we tell you have hypertension. Because if you might tell us it was just a mere situation that caused the blood pressure. No. So hypertension should not be confused with stress, because stress is different from hypertension. Many people confuse hypertension with stress. They say, why are you having hypertension? Are you stressed up? So wachane na stress, you see. People have been told always that way when you diagnose them of hypertension, but it's not true. Hypertension is a disease of its own, and we'll be learning today. Yeah.
All right. Now I've seen you've touched about the normal blood pressure for a human being.
Yeah.
Now hypertension is abnormal or
Yes, it's abnormal. Persistently elevated blood pressure. Yeah, so abnormally.
Which one is the normal blood pressure for a human being?
The normal blood pressure of a human being cannot be really described because it depends on various things. Like the blood pressure for young children is not the same as adults, and is not the same as the old people. The blood pressure for Caucasians, Africans is different. The blood pressure for male and female is different. But we have a range. So a range is, we usually have two types of blood pressures. I don't want to use that word, two types of blood pressures. Maybe two ways of recording blood pressure. That is systolic and diastolic. So systolic is the blood pressure that is usually, is it the numerator or denominator? Numerator. Then the denominator is the diastolic. So the one, when you go to a hospital, maybe they tell you your blood pressure is 120 over 80. So 120 over 80. 120 is the systolic, then 80 is the diastolic. So normally the systolic, the blood pressure that is up on the numerator part should be actually ranging from 90 to around 135, or let's say 140. 90 to 140. Then the one below, the diastolic, is now should be 60 to around 90. So whenever your blood pressure is above 140/90, it means you have hypertension. So for example, if you come to us and your blood pressure is, for example, 151/92, you have hypertension. If you have 142/92, you have hypertension. There are situations whereby there is isolated systolic hypertension, there is isolated diastolic hypertension. It is still hypertension. A good example is a person who comes to you with a blood pressure of 145/85. You see, the 85 has not passed the 90 mark, but the 145 has passed the 140 mark.
Yes.
So this person has hypertension. So people still say that unajua hii ya chini ndio mbaya kushinda ya juu. So you are controlled. No. Blood pressure is just blood pressure, whether it is the systolic or the diastolic. So we need to demystify that. The numbers really count a lot when you are dealing with hypertension, not like diabetes. I told you last time, diabetes, we don't look at the numbers so much. Although they are helpful, yes, but we look at the condition. But for hypertension, the numbers will determine your outcome. Because if the numbers are higher than the normal, then you have hypertension, it is uncontrolled. So those are the normal ranges for hypertension.
What causes this increased blood pressure? Is it the heartbeat beating faster, or so there are other causes?
There are so many other causes, and we can talk about them. People still, I repeat that, people still feel hypertension is comes because of stress. No, not at all. The only time you will have hypertension when you have stress is when you are you have anxiety alongside your stress. For example, if you lose your loved one, you have just been told the news, your blood pressure will go up, but that's not hypertension. You understand?
Yes.
If you have depression, your blood pressure will go up. It can lead to hypertension later on. But if we test your blood pressure during that period of depression, we better treat your depression first, then see if your blood pressure is high. So whenever you are diagnosed of hypertension, don't think of stress. No, there are other factors. The factor number one is age. If you are told you have hypertension, look at your birthday. When were you born? How many years have you lived in this world? If you are above 45 years, there is a very high risk for hypertension. Definitely. And that's why we are going to the communities and encouraging people.
Yes.
If you are above 45 years, if you are above 40 years, if you are above 20 years, test your blood pressure twice a year. Because that is a risk for hypertension.
Age is a risk factor.
Age is the number one risk for hypertension. Nothing else. Even if you lived a very good life and you are 40 years, that 40 years mark is a risk for hypertension. Yeah? So
I always thought life begins at 40 and you enjoy it.
Yeah,
so it's risky.
Really, that's why I'm stressing it. Then the other risk factors, of course, like smoking, heavy smokers, and smoking, I would prefer saying use of tobacco, because nowadays we have people who are smoking shisha in the clubs. We have people who are using the electric tobacco.
Vapor.
Yeah, vapor. Those days, that is still tobacco. You're just the same as somebody who is smoking, only that it has been modernized. The tobacco has been modernized nowadays. Yes. The young people who are using it, I always tell my young people, the life you are living today will determine your health after 40 years. So if you live a good life in 20s, 30s, after 40 years, your life will be better. But if you don't live a good life, you stop smoking at 40, it's good. It will give you a good outcome, but unfortunately, the risk factors that you predispose yourself to will lead to hypertension. Other factors quickly is weight, obesity. And obesity, we look at it through weight and height. So somebody needs to check their weight regularly, and even their height is always constant for the adults. So you just calculate your body mass index. You should not go above 25 kgs per meter cubic. So per meter squared.
How do you measure it? The body mass.
Body mass index is simple. You just calculate you relate it to your height, your weight to your height. So it is not supposed to. It's supposed to be 18 to 25. So anybody who has above 25, they are obese, and they need to bring it down. Secondly, another risk factor is salt, and I want to emphasize on salt. There are these salt shakers. These people, I wanted to carry one today, but I forgot. Because there are people, even if they have not tasted their food, already they are adding salt. They've not asked, they've not tasted the food, they don't know the amount of salt, to an extent that their taste buds have been changed. If you taste their food, if your taste buds are okay, you will tell them you can't eat that food. Because they are used to salt to an extent that even if you put a lot of salt in their food, they will still add salt. Those people don't live so long without getting hypertension.
It is a literal kukula chumvi.
Yes. So if you, true.
Literally.
Unfortunately they won't kula chumvi because they will eat the salt for a very short period of their life. So the literal kukula chumvi won't really be actual because hypertension might shorten your life. So hautakula chumvi sana. So if you really want to eat that salt for many years, eat it in small quantities. Make sure you don't eat raw salt. Raw salt is bad. It causes hypertension. In fact, in Africa, the research we are doing every time, like in the rural areas, people in the rural areas are having hypertension more than the people in the urban areas. Why? They take salt. You find a person has sold their maize from the rural area. They go buy mandazi. Mandazi has a lot of salt. They eat it. They get hypertension. Bread has a lot of salt. The other things that have a lot of salt, there are these smoked fish that people usually buy. Once you come from your day's hustle, you want to have a nice soup. So you buy your fish at 20 shillings. It has a lot of salt. You take it almost every day, you get hypertension.
Salt was used as a preservative.
A preservative, exactly. You can't store fish for more than a week without storing with salt. So that salt inside there is a preservative. It is causing hypertension. Bread has a lot of salt. Chapatis, mandazis have a lot of salt. Go to the villages, people don't take breakfast without bread. They don't take breakfast without mandazi and other things. Then the last but not least is exercise. You know, we can't overemphasize on exercise. The world has changed since the year 2000. You know, we were told it is a millennium. So since that time, what we had was a revolution. The computers came in, if you can remember. So when the computers came in, they made our lives bad because we couldn't move. We are always on the small phones. We are always on the computers. And
we are in the energy saving mode.
Yes, I saw another image whereby the old televisions were big, and you could not even carry them. But the size of the television has really reduced, and the size of the people has increased. So initially the people were slim, the TVs were big.
But right now so the TVs are slim.
The TVs are slim and people are big. And they are on the small phones. So those are the dimensions, and also the border borders are here with us. They'll carry you from your home, take you to the marketplace, bring you back, as you continue carrying your hypertension alongside you. So if you could drop from that border and walk, your hypertension will be controlled. So those are the simple risk factors. You know, people usually think hypertension came as a monster. It's not a monster. It is our lifestyle. So our lifestyle is what is causing hypertension in simple ways. So you've seen I've not mentioned stress. So stress comes last. So if you are told you have hypertension, just check your life. And diet also. Diet I've mentioned about salt, but there are also things like yamachoma. There are things like beer. There are people who are taking beer day and night like no man's business. And there are people who are taking changa in the villages. There are people who are taking, not even in the villages, changa is even here in town.
In town, yes.
Yeah. So we don't want to really look like we are pushing the people in the villages. No, even in town, people are taking spirits, wines and spirits, high percentage of alcohol. If you are, alcoholism is a disease. If you are alcoholic, you are just like a smoker. The risk for hypertension is high.
Now, Doctor, what are the problems that are associated with HBP or
high blood pressure?
Yes, how do I know that I have this is high blood pressure?
One thing that I have encouraged people, if you see your brother or sister, and I forgot to talk about inheritance, hypertension can be inherited. So if you see your brother, your parent, they are struggling, even you are paying their bills for checkups and drugs. Make a point of checking your blood pressure at least 3 times a year. That is number one. Number two is about hypertension. Is also a silent disease, and that's why we are here on TV.
Yes.
You will not see the symptoms of hypertension until it brings a stroke. That's why you'll hear people telling you he was just okay. Then we lost him yesterday. Yes. He was just okay. We lost him. Why? Because the hypertension was there for 2 years. He was okay in your eyes, but the body had hypertension. So hypertension reached its threshold. So it burst the arteries. So when it bursts the arteries, you get a stroke, you get a heart attack, you lose your life. So that's how simple hypertension is. It does not give you symptoms because it is almost like essential to have blood pressure. Because everybody has blood pressure. But abnormal blood pressure is what is the disease, is the elephant in the house. So these people must just check their blood pressure. And we've really pushed as a county, because I coordinate the NCD activities in the county.
Yes.
We've really pushed that all hospitals don't charge for blood pressure testing. And you don't need to queue. Just go to the hospital, go to the nurse. There is a place in every hospital, we call it a triage, the starting point for the hospital, not the reception. Sometimes they are in the reception. Wherever you see a blood pressure, just sit there and tell the nurse, can I check my blood pressure? It's very simple. You don't need to pay. You don't need to go through the whole systems of the hospital. Because most of the time, if you are very keen, if you go to the hospitals, you realize that the blood pressure is always hanging. It is not used. I don't know if you've seen
it's
that.
True,
most of the time, you'll just see the machine on the desk.
Yes.
It is not being used.
Plus the strap.
And at times, you'll even find the nurse is not there because she does not have the clients who want to be tested their blood pressure. But unfortunately, the next client who is coming to be tested the blood pressure, they are confirming that they have hypertension when already they have a stroke. That's when you'll find this nurse busy. Why? People are not coming to check their blood pressure in time. People need to come early before the symptoms come. That is the message. Come early before the symptoms come. But now, for those who like waiting for the symptoms, we can mention a few symptoms. I don't like telling you the symptoms because people will wait for the symptoms. But for those who like waiting for the symptoms, if you see a headache, if you see swelling of your limbs, if you see dizziness, they are like malaria. If you see fever, if you see chills, if you see palpitations, your heart is pumping very fast. And if you see maybe engorged neck vein, sometimes you see some people, this vein is just engorged. And maybe it is pumping a lot, either on the left or on the right. So likely these people have hypertension. They might have a chest pain. Others might start coughing. Coughing is a sign of blood pressure.
Yes.
And the weakness, you get tired easily. So that is a sign of hypertension. Yeah.
Those are the signs that are associated with hypertension.
Yeah.
And how do someone with hypertension regulate it?
Very simple. Just like any other disease, any other chronic disease, the earlier we find it, the better. If we find you in stage 1, we classify hypertension from stage 1 to stage 4. So if we find you in stage 1, there is all pre-hypertension. Pre-hypertension, this person has not gotten hypertension. So these people, they are the ones who have a blood pressure of, some days you go to the hospital, it's 140, 130, 135. The doctor tells you, you are almost developing hypertension. So those are the people we like seeing, and we want them to come to the hospital so that we can prevent them from getting the full-blown hypertension. And it is simple. We'll tell you the right food to eat, exercise to do, and we'll not give you drugs. We'll just advise you on what you can do in your life. Then after that, we will be able to now monitor you every month or after every 3 months. Then for those who have stage 1, stage 2, stage 3 hypertension, there are treatments. We will reverse the hypertension. If it is stage 4, we'll reverse it to stage 1 and even to normal. We can reverse it back to normal. But it does not mean that you are healed of hypertension. The moment you move to stage 1, there is no healing. Unfortunately, it's not a good thing. And I know there are many people who are spiritual who are watching and they believe it is healed. It is good to have a belief, but walk the journey with the doctor. I always tell people, even if you pray and hypertension gets healed, also come to the doctor and the doctor justifies that it is healed.
It is true,
And we have to make a follow-up. That's where people go wrong. People take their drugs, they start their drugs very well because they fear those numbers. You know, when they come to the hospital, it is 200. Even you start calling your relatives, you know, my blood pressure is 200, and the doctor, you are just worried. But the moment the doctor tells you after 3 months your blood pressure is 130, you start now, you become complacent, and you feel like your blood pressure is now normal, and you stop the medications. These are the people who come back to us 3 years after with a stroke. Imagine. So you stop the drugs without the doctor's consent, and you now come back after 3 years, again back to the same doctor with a stroke. A stroke is not reversible. These are the people who will accept taking their drugs for a lifetime, but unfortunately it has already paralyzed you. So which one is better? You better take your drugs, continue with your normal life, than take your drugs when you're paralyzed.
Yes.
You realize? Because when you're paralyzed, your life is incapacitated, and you cannot do anything.
Yes, that's
so
true.
that is how we control blood pressure. We have to make a follow-up every 3 months, 1 month. You can't just take the drugs over the counter, which many people are doing nowadays, saying, because people want to buy the drugs from the counter without even consulting the doctors.
Now, how do we differentiate? You have talked about the swelling of the limbs.
Yeah.
How do I differentiate the swelling for high blood pressure and that for I don't know if it's coronary thrombosis or something.
Yeah, coronary thrombosis means you have a clot in a simple language. And if you have a clot, the clots are always acute. They cannot be chronic. So if it's acute, that swelling of the limbs starts today and it keeps on worsening. And you know, coronary thrombosis means the clot is on the heart. So sometimes you might not even experience those swelling of the lower limbs. A coronary thrombosis is just a clot. It's just a topic on its own. It's like a heart attack. So if you have a thrombi, a clot on your heart, you might lose life if the clot is not removed urgently. But I understand. Swelling of the limbs does not mean that you have hypertension alone. You might have kidney disease. You might be pregnant. If you are a woman, you might be having, you might have traveled for long, you don't have hypertension. You might have sat for long in your office.
Yes.
You might have taken a lot of fluids. There are people who might, because of weather, they might take a lot of fluids.
Yes.
And not all of it is cleared. You are still swelling, your limbs will swell. And many, many other causes, but you have to be sure, confirm.
So the best way to find out whatever is causing your swelling is to come to the doctors.
Yeah, because the doctors have the best knowledge to tell you if you have a hypertension.
All right.
Yeah.
Now we are taking a short break here at Health, Hygiene and Wellness. We'll be back with more insightful discussion. When we come back, I would like us, Dr. Ari, to talk about the treatment as well as the diet for high blood pressure patients. And that will be right after the break. Don't go too far.